In this video, you will learn how to effectively use vibration therapy to relieve the pain of bulging discs at L4, L5, and L5S1. Vibration therapy could be the breakthrough that you need to relieve the pain and symptoms associated with an L4, L5 disc bulge or L5S1 disc bulge. It's really a powerful tool that can reduce inflammation, enhance tissue healing, and improve flexibility. Keep watching because I will introduce you to these 3 effective vibration therapy techniques. These methods have been proven to significantly alleviate the discomforts and enhance the body's healing process in treating bulging discs at L4, L5, and L5S1. What's more, vibration therapy isn't just for those dealing with disc issues. Elite athletes like Tom Brady, Mark Wahlberg, and Serena Williams use it to stay in peak condition, extending their careers well beyond the norm. Vibration therapy is safe for everyone, kids, seniors, athletes, and you can do it daily, giving you the same advantages that keeps the stars like Tom Brady playing for years. So dive in with us as we explore how vibration can be the part of your strategy to manage pain and enhance mobility. Dealing with the frustration of limited mobility, soreness, pain, and stiffness from disc bulges can be overwhelming. The great news is there are effective alternative treatments available that are beyond relying solely on anti-inflammatories or other remedies for relief. One such therapy is vibration therapy. So what really is vibration? Vibration is exactly what it sounds like. Of course, it's a feeling of sensation that goes through tissues that creates an effect, right? But there are good vibrations and bad vibrations. So when we talk about bad vibrations, studies have been done that shown that people under certain types of vibration, they're aging faster, their tissues are damaging faster, degenerations are occurring faster. What kind of vibrations? We're talking about those in long-term drivers in trucks, heavy equipment operators. Those kind of equipments are going to be a vibration that's really detrimental to the health of the body. So that's obviously the stuff we want to avoid. But when vibration is used in a good way, the right type of vibration. So in our office, we use 30 hertz vibration. So that is a good vibration. It's been studied. It helps in healing. It helps in relaxation of muscles. It helps in blood flow, especially targeting these discs that have not been working for so long. We're going to get vibration into those tissues in a variety of ways that is going to help with relaxation, flushing out the disc and creating new circulation and healing tissues at a faster pace. So in our office, we have 3 types of vibration. So we're going to talk about whole body vibration. These are platforms that you're going to stand on top of. We're going to talk about targeted vibration using specific tools that get to the tissues deeper penetrating. And thirdly, vibration foam rollers. These are the ones that even athletes are using to create relaxation in tissues at a much faster pace than they would on their own. So we're going to get into those and explain all 3 types of vibration next. All right, so the first of the 3 types of vibration that I really recommend is going to be whole body vibration. These are platforms. They're specifically for us to stand on top of. We're going to have Bianca join us on how to stand and position herself. She's going to get on here to really reinforce this posture around the L4, L5 disc bulge, right? We're using vibration as a body to create circulation internally, and that helps affect every tissue in our body. By getting draining of the lymphatics, it's going to get all these sore leg muscles that the disc bulge has created, all these tight muscles in our glutes and our spine. Everything's going to start softening up and flushing so those discs have better mobility and things recover faster. So as we turn this on, Bianca's going to form a good posture to reinforce good alignment around the spine. And by doing this, it's reprogramming the neurology around that disc bulge. Turning this on, it's very gentle. It feels very relaxing to be on here. Normally our patients are on here from anywhere from 1 to 5 minutes. It feels like a whole body massage as you come off because all the tissues are now flushing out of all those toxins, the lactic acid and all the sorenesses that have been created from these tight muscles. Thank you, Bianca. So as we turn that off, basically that's the idea of whole body vibration. This can be done in office. It can be purchased to use at home, of course. Every day standing on this for up to 15 minutes. People even do exercises on whole body vibration because it accelerates the results of those exercises compared to doing it on the floor or at a gym. So definitely whole body vibration is going to be really profound as part of the recovery from L4, L5 disc bulge. So the next type of vibration that we use in this office is targeted vibration. So what I use is a rapid release therapy tool here that is going to take vibration and focus it into the actual tissues around the L4, L5 disc bulge, and it creates a relaxation effect. The purpose of this is to use different parts of the tool to target the muscles in a way that breaks down scar tissue. So our scar tissue, when it's there, it's not the same as regular tissue. Regular tissue is much more strong. It's lined up in a linear fashion where the tissues are working together. Scar tissue is obviously from injuries, poor posture, things like that. And that tissue is healing the area, but it's healing in a crisscross pattern. So it's really not stable, and that tissue can be shattered using the vibration. So the focused vibration, when applied to the muscles around the problem area, whether in the lower spine, there's the spinal muscles, such as the quadratus lumborum, the glute muscles, the piriformis muscle, the hamstring muscles. All of these muscles are affected by the cause, which is your L5, L4, L5 disc bulge. And when we use the vibration, it can rush into the area, flush out the inflammation, and break down that scar tissue and soften the muscles so that we can actually get healing around the area at a faster pace. So when I turn this on, the vibration is now affecting the area, targeting. I usually like to apply it right into where the disc is. It's going to create a flushing effect into the cartilage, bring more blood flow, take out toxins, flush out lactic acid, bring in new nutrients for the disc to heal. So as we've got this going on into this area, it feels like a deep penetrating massage. Obviously, it's very relaxing for the muscles, and applied correctly, it's really going to accelerate the healing process and letting these muscles just, basically I can feel them letting go underneath. And it feels great. It feels like coming off the table like you've had a massage, and it's going to really affect the recovery in a much more effective way. So this is targeted vibration using different targets with trigger points and targeting with flat surfaces that really are gentle and effective for relaxing the muscles. So the last tool that we're going to talk about is another home therapy device that can use it at home. It's one of the most effective things I've ever added to my routine of exercise and stretches. So really, I recommend this for everyone. This tool is some of the stuff that I got this idea from Tom Brady himself, who's been playing in the league, NFL football player, for one of the longest careers of any football player, because this is a tool he actually found and discovered gave him pliability. So pliability is the purpose of this one, especially because pliability means the lengthening and softness of our tissues. So when we have muscles that are tight, they're obviously not very pliable. They don't have give, and that's been created by tight nervous system, and the disc problems at L4, L5 can create trigger points, muscle tightness down the chain of your legs. The hamstrings get tight, and that means lack of pliability. So vibration used with home rollers is going to create a double effect. It's going to have an effect of creating longer tissues, and the vibration is going to break up scar tissue. It's going to soften tissues a lot faster. So this tool is amazing. This one's by Element. It's called the Aftershock. It has 4 levels of vibration. If you use this, you can turn it on and hear the vibration in 3 and 4 levels. So obviously you can use this in different ways, right? So when we target muscles, you can use this just like the rapid release that I was using on my patient there. You can use it by targeting muscles, just sitting as you watch TV. As we place this behind us, it can be used like as a substitute massage chair. So that's why I really like this tool. Putting it under your thighs can create a relaxation. Putting it under your knees can help the vibration go into your knee joints. Putting this under your feet and rolling your feet, it can help with plantar fasciitis. It can help with all the tight feet muscles that we have. So there's countless ways. So, there's so many ways you can use this tool. Take it on the road with you, travel with it. It's just one of the best tools that are most effective for so many conditions. So when it comes down to L4, L5 disc bulge, using this along the posterior chain. So we talk about the muscles that are in the back of the legs, especially the glutes, especially the lower back, of course, targeting that direct area. Donna's going to exemplify this for us. We're going to turn this on just at one level, so you can go ahead there. So we start from the lower leg. So when we use this, the tight calves, the poor circulation, Donna's going to roll that on each side. Generally, we would do this obviously on both sides of our legs, starting with 5 to 10 repetitions a side. I like to learn how to use it first, and then you can feel the relaxation taking effect and then use your judgment, right? So we have patients who love to just stay in one area for a while just to get the targeting of the muscles and really relaxing the tightest points. So you'll come to find you get trigger points, you find tight balls of muscles underneath here, and you can just let it sit just like that. Then we move up to the hamstring next there. So that's from the knee up to the hip area. Donna's going to target all these tight hamstring muscles. We all get tight hamstrings from sitting at our desk, sitting in the car, and just tight muscles from lack of movement, right? So as we do this, that's going to be one of the best muscles. It really feels good in there to get some of the soft, supple, pliable muscles that we're looking for when it comes to hamstrings. Next, Donna's going to move that up to the glute area. So this is what we talk about when it comes to sciatica from L4, L5 disc bulge. There's a lot of muscles in here that actually the nerve runs under, one especially called the piriformis muscle. So that muscle is going to impinge the sciatic nerve, and by rolling on one side at a time, those glutes are going to relax, the piriformis is going to break down. This really shuts off the nervous system in that area much more effectively than foam roller does on its own. So it really has a great result in trigger points. You find those tight points. Donna's breaking up some of those tight points just by staying on it, rolling on it. You can have a variety of ways to target those tissues. Next, we're going to move up to the lower spine. So when you use this on the lower spine, we're going to be careful because of obviously having an L4, L5 disc bulge. We're going to make sure that we keep it to one side. So she's leaning on that side, using her elbow as support, using her legs to rock and roll over the area to get the tissues to, again, get more blood flow, break up scar tissue, help flush out those toxins that the bulges and disc herniations can create, but obviously very gently. We start light in the beginning, see how you feel, and then a day or two later, do it again, and then see if it's comfortable. We should never aggravate any tissues in here by increasing pressure in the disc. So as she's done that, she would obviously have done both sides. Now we're going to move to the upper back just to help iron out the rest of the spine. So when we do the upper back, it's going to be in the center. So by doing it in the middle here, we have so many tissues that overlap the spine that this is a very safe procedure of higher. From the neck, Donna's going right to the mid-back, and she feels it obviously there. That really gets into all the upper back tissues and fixes that posture. Because you've been flexed forward from the disc bulge, we want to iron that out so you get into an open posture and it takes the load off the lower discs in our spine. So foam roller, and using the vibration foam roller especially, is going to be one of the best tools that you can use at home in a variety of ways in your road to recovery from L5-S1 disc bulges. Okay, so now you've seen countless ways that vibration is one of the most powerful tools for you to use in an office environment, at home, obviously. Using this tool is another trick that you just learned, that having this vibration roller at home can save you thousands and thousands of dollars on these fancy massage chairs when really we're looking for the specific type of vibration that targets the muscles. Use this at home, bring it on the road with you, use it at the office to really use as a massage chair on the go. Discovering vibration therapy can be a big difference in decreasing the recovery time of an injured disc. It can help keep your muscles pliable and relaxed, reducing pain, healing the injury, and preventing muscle spasms. How about you? Has your therapist or doctor used vibration therapy in your treatment program? How did it work out for you? Leave a comment below the video and we'll talk further. If you found value in this video, be sure to like and share it now. And go ahead and subscribe to my channel now. If you want more tips on how to relieve sciatica and disc-related pain and what treatments actually work for L4, L5 disc bulge. Now, the next video you should watch is this one, where I demonstrate 5 unique and easy exercises for relieving pain from an L4, L5 disc bulge, L4, L5 disc herniation. Go ahead and watch this video here to follow these exercises.